Fantastic question. So what are healthcare disparities? The main one, of course, is the life expectancy, the difference how for minorities versus non-minorities in certain neighborhoods. We have the life expectancy, the burden of disease, you have mental health, and of course, again, insurance, underinsured, no insurance, and the lack of access to care. So how can physicians be better allies? Again, it comes down to the main important thing, communication. Not only communication, but effective communication. Realizing if the person that you're speaking to understands what you're saying and is able to follow through. A lot of times we can communicate with our patients, but do they really understand what we're saying? Do they understand the importance of it? Have we followed through on what is called the loop communication, where what I'm saying is received and understood by the other party, and I'm able to do a follow-up and find out if they really understood what I was saying. That's extremely important, because a lot of patients can leave the doctor, and if they leave the doctor's office totally confused, not understanding what was said, not communicating, not feeling comfortable enough with the doctor to say, I really did not understand what you said. Can you explain it to me? They will not come back. We would have lost that patient and probably many more, because they would tell their friends, and then the vicious cycle of disease, progression continues. So just making sure that we communicate effectively with our patients. Also, I believe physicians need to have empathy, really need to understand where the patients are coming from, understand their culture, understand why they may not, as physicians, sometimes I don't understand why this patient is not doing this or that. It seems very logical. It's irrelevant whether it feels illogical to you as the physician. What is relevant is how the patient feels and what you can do to alleviate their fears and concerns. So having a certain amount of empathy for our patients is also important. We also have something called provider bias. Everyone has biases. It's part of human nature, unfortunately. As providers, we need to really look at our own biases, acknowledge them, and realize that we do have them, and deal with it through our own process of becoming better people and better physicians, dealing with our biases, maybe towards a culture, a race, and realizing that we do have issues and we need to work with them in order to be not only better people, but better physicians. I think there also need to be some cultural competency training for healthcare providers, especially when you're dealing with large immigrant populations of people that are coming in. Having a respect for certain people's culture would also carry a long way. How people believe with families, how they treat their children, the role of the husband and the wife, which may not be our culture, but if we're dealing with our patients, we need to understand how their culture will affect how they view physicians and how they will view and deal with the information that we're giving them. Also keeping up to date on the latest medical developments, especially where you have areas of high health illiteracy, making sure we are up to date, that we have the latest information, so we can impart that knowledge to our patients. And also, I believe engaging in policies right now, being able to advocate for our patients on a government level, advocating for better health care, better housing, better transportation, better schooling so that health literacy is not as serious as it is now. And then partnering with organizations, belonging to organizations that, is in keeping with your area of expertise. I belong to the American Cancer Society, so I keep up to breast with that, the American Nurses Practitioner, keeping up to date with the latest organizations that deal with whatever vaccination or cancer treatments that you're dealing with, so that you can get as more information, so then you would be in a better position to explain and impart knowledge to your patients. And it all boils down to effective communication, empathy and compassion, and really love for the job that you're doing in order to help your patients lead better lives.